Prostate cancer is important because it's increasing in incidence and it often affects otherwise healthy men, not necessarily in old age. It's highly curable if it's confined within the capsule of the gland. That's an envelope of tissue which goes around the gland. Having diagnosed it, some oncologists may still watch and wait for some time because prostate cancer can be indolent. But that decision can only be a sensible one if you know what you're dealing with. So it's important to diagnose it early. And indeed, that's the same for all cancers. The simple blood test of PSA is a very appealing one because it's a simple blood test. It's fairly specific for prostate, but it's not specific for prostate cancer. Other conditions, the aging prostate, inflamed prostate, these can all give rise to raised PSA values. So we need some better test. Fortunately, there is a new test coming out. It's been developed by Chronix, and it's to do with detecting mutated DNA fragments in the blood from dying cancer cells. All cells in the body live and die, and for a transient period, their degraded DNA, fragments of their DNA, circulate in the blood until they're eliminated from the body. Using next-generation sequencing, that's the technique that allowed us to type the whole human genome, we can now tell which fragments are mutated and from a cancer, and incidentally it'll tell you if there's a cancer anywhere in your body with fairly high degree of specificity. We can tell whether there is likely to be a prostate cancer. We do this because there are certain hotspots, certain gains and losses that correlate with prostate cancer. And from a simple blood test, we've got something that is more specific for prostate cancer and also very sensitive. I think PSA will remain. It's a good screening test, but it lacks specificity for prostate cancer versus other prostate conditions, and it's not as sensitive as we would like. Chronix have developed this test for cell-free DNA, detecting the mutated DNA fragments from a prostate cancer. I believe this is likely to come in as a very important screening test for prostate cancer within the next few years. Trials, observational trials, are pending on this, but the ability to detect mutated DNA fragments, which incidentally could detect a cancer wherever it is in your body, but there are specific hotspots so that we find correlate with prostate cancer. We believe this will be the next generation of important screening methods for prostate cancer. Prostate cancer is most curable when it's confined within the capsule, that's the envelope that goes around the gland, and certainly surgery has been the gold standard of treatment so far. But there are other methods which have perhaps less side effects than surgery, less consequential side effects, incontinence, that sort of thing, which have an equally good cure rate. Most of them are radiotherapeutic. Many of them are to do with external beam, a beam shining at the patient's prostate from standing off the body and not requiring any sort of surgery at all. But equally, brachytherapy, the implantation of radiation seeds into the prostate, is by a relatively small surgical procedure able to eliminate a gland without the extensive surgery that's required to actually enucleate the gland at operation. So some of the radiotherapeutic methods are now vying with surgery and have the advantage of lesser side effects. There are other methods. Some people, where there is very focal areas of the prostate involved, will look at focal methods. But in general, most people treat the whole gland for most prostate cancers. High intensity frequency ultrasound, radiofrequency ablation, cryotherapy have been mooted as being competitors, but none of them have the long-term validity of surgery and radiotherapeutic methods.